Okay, we're going to go over the results of your sleep study. What we're looking at is 30 seconds of time, 19 different physiological parameters. These first 6 are brainwave channels. It tells us when you go to sleep, how deeply you sleep, and how often you wake up. These 2 blue channels are eye wave channels. That tells us when you go into REM, or rapid eye movement sleep, which is where you do your vivid dreaming. And it's fairly typical every 90 to 120 minutes to go through a cycle of REM. This is the electrocardiogram that tells us the heart rate and rhythm. This is the snoring channel, so we can see some snoring here. This is the airflow going in and out through the nose. This is chest and abdominal movement with breathing. Now here we can see the chest and abdomen trying to breathe, but there's very little airflow going. And here we can see the oxygen drop down just a little bit. This is an example of a partial apnea or a hypopnea. This is your oxygen over the whole night. That's this channel here over the whole night. And we can see there are some mild fluctuations in oxygen, the lowest going down to 89%, which is a mild drop. Normal is above 90%. This is your sleep stages over the whole night. Blue is awake, and you fell asleep in about 7.5 minutes. You went down to stage 1, which is pre-sleep, and then stage 2, which is light sleep. Then over here you went down to stage 3 and 4, which is your deepest, most restorative sleep, characterized by these tall, wide brain waves. And you had a few awakenings, these blue marks here, where you're awake here for about a minute, here 30 seconds, a minute, a number of little ones. Most of them are too short to remember. And here's your first REM cycle, where you do your vivid dreaming, and then another REM cycle here, here, and here. And it's typical to go through cycles of REM and sleep every 60 to 90 minutes. I'm going to go to a 2-minute screen so we can see more information. Here we can see the airflow getting a little shallower, a very slight dip in oxygen. The brain wakes up for a moment, and then you take bigger breaths and snore. And then you go back to sleep right about here, and the airflow starts to reduce again, getting very shallow, small drop in oxygen. The brain wakes up a little bit again, and you take a bigger breath and snore. Each one of these events is scored green, and you can see them here on this line. So altogether, you woke up to breathe about 89 times, and that works out to about 12 times per hour of sleep. So if we see 5 or less, that's considered in the normal range. 5 to 15 is considered mild sleep apnea, so 12 is in the mild range, you're mild. 15 to 30 is moderate, above 30 is severe. So it's mild, but it's still significant. In other words, it's still going to affect your sleep quality and make you a little bit tired, and so it's worth treating.